Good afternoon. I appreciate you joining me today as I give you an update on COVID-19 pandemic here in Erie County. Unfortunately, today we have 272 cases to report as of late last evening, which brings us a total of 7,441 cumulative positives since March. If you need to get tested, the community centers in the city of Erie are offering free testing on dedicated days of the week, and other testing sites are available by appointment. And all of that information about the testing sites throughout Erie County can be found at eriecountypa.gov. In addition, and this is really important, if you do get tested, please stay home until you get the results of your tests. Stay home, and if you're positive, of course, you need to continue to isolate. But please don't go out until you have the results of that test. Beyond the positive cases, unfortunately, we have 15 additional deaths to report here in Erie County from the NEDS system in the last 24 hours. This brings us to a total of 135 of our fellow residents who have died from COVID-19 in Erie County during this pandemic. To put that in perspective, less than a month ago, on November 11th, I reported we had 57 deaths, and now we have 135 deaths. You deserve to know this, to know the truth about what this virus can and is doing to your fellow residents, maybe your neighbor, maybe your family member, maybe your friend here in Erie County. Across this country, over 250,000 people have died during this pandemic from COVID-19. And as of this morning, 150 people currently hospitalized in our Erie County hospitals from complications of COVID-19, and 13 of those individuals are on ventilators. We don't want anyone to be hospitalized with this virus, but we are a bit relieved that the numbers have stayed relatively the same over a few days' time. As we know, our hospitals are working so very hard to keep those people alive and hopefully home soon. But comparatively speaking, in April of this year, 202 people were hospitalized throughout the year with the flu, with a total of 6 deaths during the 2020 flu season. Hopefully no one is any longer comparing COVID-19 to the flu. We have 135 deaths from this virus, many more than we ever see from the flu during a flu season. Since November 12th, our case counts in Erie County have been over 100 every single day, and now we have numbers well over 200, approaching 300 daily. I need to say this again. We need your help. Our mission is to eradicate this virus from Erie County, and it is the collective responsibility of each one of us to assist in making that happen. We need every one of you to wear a mask that covers your face, your nose, and your mouth when you go out near anyone who does not live inside your home. We need you to keep that 6-foot distance from others and to stay home as much as possible indefinitely. When you are feeling ill, stay home, or if you have gone for a COVID-19 test, stay home until you get the results of that test and know you are negative. Limit your activities outside of your home. I get it. It's not easy to make sacrifices. It's not easy not to see your family, your friends, your neighbors, especially during this holiday season. But the truth is, we all must do our part. We can only make a difference if we all collectively come together and look out for each other and have the responsibility that we are called to as citizens of this great nation. We don't want to have another funeral. We don't want to have the empty chair at next year's holiday celebration. So if you want to take extra step beyond that, I encourage you to go to eriecountypa.gov, Take the Safe Choices Pledge in the fight against COVID-19. Acknowledge your role in protecting family, friends, neighbors, and this community as a whole. And also, please download the COVID Alert PA app if you have not done so far. If you have a smartphone, you can find it in that app store. All of the demographic information that you have heard and might want to see can be found at eriecountypa.gov. And as you know, we have many, many resources on our website for you. And now, as always, I'm pleased to invite Director Melissa Lyon from the Erie County Department of Health to share an update. Melissa?
Thank you, County Executive. So I'm here to talk to you today about the change in instruction for quarantine of close contacts, those that have been exposed to a person that's positive with COVID-19 infection. On December 2nd, the CDC provided an option to reduce the length of quarantine for contacts of persons with COVID-19 infection using symptom monitoring and diagnostic testing. Late Friday, December 4th, the Pennsylvania Department of Health released the same option, making clear that the test option is only for areas that can support additional testing capacity. Erie County Department of Health does not support ending quarantine. Erie County Department of Health does support ending quarantine on day 10 without testing, and if no symptoms have been reported during daily monitoring. With this strategy, residual post-quarantine transmission risk is estimated to be about 1% on the upper limit and 10%. What that really means is that between 1 to 10% of people out of quarantine at day 10 will become positive and could possibly transmit the disease to another person. Persons can only discontinue quarantine at day 10 if the following criteria are being met. No clinical evidence of COVID-19 has been detected by daily symptom monitoring during the entirety of the quarantine up until the time in which quarantine was discontinued, and daily symptom monitoring continues through day 14. What that means is that you've had no clinical evidence of COVID-19 in the first 10 days and that you continue to monitor your symptoms through day 14. Persons are also counseled regarding the need to adhere strictly through day 14 after the exposure to all of the recommended non-pharmaceutical interventions. That includes wearing your mask properly and social distancing and only moving about the community in the least amount that you need to and that you must. So again, we're asking you not to go back to all of your daily activities if you can prevent that. If a symptom develops, you must immediately self-isolate, contact their local healthcare provider or the health department to report this change in clinical status. This guidance is provided for the community and does not apply or override any other healthcare or congregate settings. Those settings should continue to follow the previously provided guidance from the Department of Health. Erie County Department of Health is taking the 10-day quarantine approach because local testing resources are not adequate to accommodate a surge in testing requests for persons without symptoms of COVID-19 disease. Current testing capacity is unable to provide enough test collection and test results in a timely fashion for those that are currently experiencing symptoms, let alone to increase in testing requests for asymptomatic persons desiring to decrease quarantine. So the goal of the reduced time is to reduce the burden of quarantine for persons exposed to COVID-19. But please remember, this does not guarantee that someone has come out of quarantine at day 10 will not become positive, because the most preferred protected recommended quarantine period will always remain 14 days post-exposure, because that is the incubation period for COVID-19 virus. So it is very important that if day 10 you are released, you must be diligent in your symptom monitoring and your adherence to all of the non-pharmaceutical interventions. Thank you, County Executive, and I hand it back to you.
Thank you, Director Lyon. And now we're going to have David George, a familiar face and voice on these press briefings. He's the Supervisor of Environmental Health Services at the Erie County Department of Health, and he's going to share an update. David?
Thank you, County Executive. Our environmental team has started to conduct COVID-19 response inspection reports. This inspection report is based off a document that the Pennsylvania Department of Agriculture is using, and its main goal is to ensure that retail food facilities are complying with the governor's targeted mitigation measures. Inspections are conducted based off the complaints that we receive and also at random in order to be equitable to all establishments. These reports can be found at the Erie County website under the Health Department page on the right side of the screen under the category Community Health Interest, and also based on a search engine using COVID-19 Response Inspection Reports, Erie, Pennsylvania. These reports are available to the public so they can be informed of which food establishments are following the COVID-19 mitigation guidelines so they can make informed decisions about places they wish to dine. In preparation for these inspections, the environmental team hosted 2 virtual meetings to go over the details of these inspection reports and to answer any questions that restaurants may have, and so that restaurants were not surprised by these inspections. The Department of Health has maintained a good working relationship with the licensed facilities and continues to work with these facilities to help ensure compliance. We understand that these are challenging times and that there are no quick and easy solutions to eliminate the COVID-19 pandemic. One of the primary goals of these inspections is to help inform and educate facilities on these COVID-19 guidelines and orders, as these orders are fluid and are constantly changing. We also offer suggestions and recommendations on how to best implement these mitigation measures and discuss best practices that have been seen at other facilities. Every restaurant has different, unique, and challenging circumstances, and we want to ensure that the employees and customers are as safe as possible while out in the community. So far, the most frequent violation we are coming across during the inspections has been employees not wearing masks while working. The only time employees should remove masks is while on break or eating or drinking. This is important to keep employees safe and to ensure that the facility will have enough staff to operate properly. Some stores in other parts of the Commonwealth have reported that they have had to shut down for a few days due to staffing shortages. If a facility is out of compliance, a reinspection will occur to check to see if they have fixed the violations. Some violations can be corrected on site. If the facility is out of compliance on the reinspection, a notice of violation or further enforcement action may be warranted. Our team has also collaborated with many other community organizations to help keep the community safe from the spread of COVID-19. We've met with the Second Harvest Food Bank and local food pantries to ensure that food is distributed as safe as possible to those who most need it. We continue to offer our strike team visits to local school districts to help them navigate during this substantial level of community transmission, and have expanded these visits to homeless shelters, congregate care facilities, and some apartment complexes. We have met with the Early Learning Resource Center to help ensure that Erie's childcare and early learning programs are as safe as they can possibly be, and will continue to help the community to the best of our ability. Finally, if you go to a store or restaurant and don't feel comfortable, leave and come back at another time when it is less crowded. It is up to all of us to help get this pandemic under control. If you're out in the public, treat everyone as though they may potentially have the virus. Wear a mask, keep at least 6 feet of distance, and wash your hands frequently. Thank you, County Executive.
Thank you, David. Thank you to your team who has been working so hard for so many months with our local businesses, with our schools, and with so many other organizations, really trying to help set them up for as much success as they can have during this pandemic and even beyond. So again, great work from the environmental team at the Erie County Department of Health, and I'm grateful. We're going to start with the media now, and today we're going to start with Erie Times News. David, are you with us?
Hi, yes, Kathy, thank you. The number of deaths the last 2 days and what we've seen the last week and a half has just been incredible. I think it's almost a quarter of the total deaths have been in the last 2 days from COVID. Why are we seeing so many deaths?
Well, I can let Melissa Lyon certainly answer part of this too, but I think one of the things we know is as the cases were rising, then the hospitalizations also go up, and of course the deaths go up. So it's really about the number of cases, and then of course our most vulnerable populations have been struck with the virus, and we've had many deaths amongst those people. But I'll see if Director Lyon has anything further on the details of the deaths.
Thank you, County Executive. David, thank you for the question. I don't have anything really additional to add. The County Executive answered that question as I would have answered it myself. The idea behind cases going up results in hospitalizations, which will ultimately result in more deaths. I think from a public health perspective, the one thing I would add is that there's always a concern that if the health systems become overwhelmed or unable to keep up with the demand, that can potentially have an impact on the outcome of individual patients due to patient care. It's at no fault of the hospital system. It's what happens in a pandemic. And when a pandemic hits an area, not only are the individuals sick, but the staff may end up being in quarantine, and staffing shortages end up being problematic. So from a public health perspective, we know that pandemics impact multiple infrastructures that we rely on as a society to remain healthy, safe, and well. So this is to be expected when pandemics hit an area. We've talked about it for decades in public health. And it's unfortunate that we're in the position that we are in now. Thank you.
And just to follow up quickly, the State Health Department was reporting earlier today 106 of the deaths are nursing home residents. I don't know if you have a break that's more recent than that, counting the 15 today. Do we know how many, an updated figure on how many of those 135 deaths are nursing home residents?
I don't have an.
I do not have that breakdown, David.
All right, thank you.
Erie News Now.
Hi, Paul Wagner, Kathy. A little update on more on nursing homes. We know that the National Guard is helping out at Pleasant Ridge Manor. What's the situation of Pleasant Ridge Manor and overall in the nursing homes? Can you kind of give us a brief overview?
Well, I know Pleasant Ridge Manor has been particularly hard hit by this virus, and they have had multiple deaths, over 30 deaths last I heard, unfortunately, and the vast, vast majority of the residents there have all tested positive at one point or another, as well as many of their staff members. So the National Guard, I think, was mostly brought in to help with staffing issue because that became, very much of a struggle as more staff came down with the virus. So I know it's a very difficult situation out there. Hopefully, now that pretty much every resident has tested positive, they should be on the upward side, I guess you might say, as people recover, because many are recovering also from COVID-19, and hopefully things can get back to normal. But it will never really be back to normal, will it? Because over 30 people will not be there, people that they care about, those who work there, and people that are loved in this community.
Thank you.
Talk Erie.
Yes, hi. Thank you, County Executive. This is Joel Natale. The news just pushed within the hour that Governor Tom Wolf has tested positive for the coronavirus. And given, his extraordinary efforts to do the mitigation factors, what do you think went wrong there? And how can we be confident about us being able to be safe if the governor, with all of his resources, still can get COVID?
Well, I can't speculate anything around the governor's case and how he got it or anything like that. Obviously, we hope that he has a complete and full recovery. My understanding is he has no symptoms at this point. It was a routine test, and we know that the asymptomatic piece of this virus is actually one of the most dangerous pieces of this, that there are people who are asymptomatic, and maybe that was the case. Again, I don't know, but asymptomatic people spread it in ways that we didn't really see with many other viruses. So I think what it says about this virus is every one of us is at risk. There's not a single one of us who's not at risk of getting the virus and potentially spreading it to other people. And that's why we all have to be extra diligent, as we've talked about for months here, because we don't know if we may be the next person who this virus takes advantage of. It's always looking for a host. We've said this from a long time. Melissa Lyon has said it's a tricky virus. It's a sneaky virus. It's very, very good at doing what a virus wants to do, and that's find a host. And so it unfortunately has found a host in our governor. And again, I hope all of us keep him in our prayers and that he has a full recovery.
Just a follow-up. I mean, again, for someone that would be so on every mitigation factor, is that giving us some kind of a metric or a percentage of what will work and what really doesn't work? I mean, doing everything that the governor did still meant a positive.
Again, I can't even begin to make assumptions as to what kind of situation the governor might have been in, was in. I can't. All I know is what I saw on the press release that everyone else saw. So that's all I know.
Thank you, ma'am.
Mm-hmm. Jet TV?
Yep. Hi, County Executive. It's Samir. So without reporting on rumor, of course, Governor Tom Wolf and Secretary of Health Rachel Levine have made public that they would look into tighter restrictions due to the surge with COVID-19 cases. So I guess let's just go to the farthest extreme. If they were to enact a statewide shutdown, is that something you would support?
Well, I can't say what they're going to do, and I won't even begin to make a guess at what that is. But I will say I doubt that that will happen at this point. And that's just my own personal opinion. I have nothing to back that up.
Right. And then I guess just taking a look at mitigation efforts in general, is there a certain effort that you would like to see put in place currently?
One of the things I've been talking about for the last few weeks is, unfortunately, so many of the cases of COVID-19 are coming from what people do in their homes or very much on their own personal time, or maybe even in a business. They might be on the outside following all the mitigation guidelines that we put in place, but maybe in the back rooms when they're not with customers, maybe they're not. I don't know, so how do you regulate things like that? It's very difficult to regulate if somebody decides to have come over and watch a movie and have pizza together on weekend evening. How do you regulate somebody who wants to have a baby or a bridal shower in their home and invites their family and friends? You cannot regulate those type of things. So that's where the problem comes in, because, again, I've seen in Erie County anyway, over and over again, that our businesses are really doing the right thing. I observe them when I go out myself, whether I'm at a big box store or whether I'm at a small store owned by a local Erie owner. They're all trying to do their best to stop the spread, and I think we haven't seen any great spread of this virus from our businesses. So I can't say what would be the best thing to do at this point, except we just need people to do the right thing.
Got it. Thank you.
Mm-hmm. And we'll go back to, is there any other news media with us today? I just want to make sure. We'll go back to David at Erie Times News.
Thank you, Kathy. This one's for Melissa. Melissa, any indication from contact tracers, disease investigators, that we're seeing a lot of cases from Thanksgiving Day dinners or gatherings?
David, unfortunately, I really don't have that level of detail because, as you know and have been reporting, our level of disease investigation and contact tracing has been limited. So that information has not trickled out of the numbers. What we're doing is we're focusing on getting letters sent very quickly out to everyone that is a known positive so that they can do the right thing and contact the people that they've been in contact with. So unfortunately, I don't have those level of details, but if you look at the calendar and when activities would have occurred for Thanksgiving gathering, we can make some assumptions that these numbers are related at some level, some degree of activities around Thanksgiving. Thank you.
Sure. And to get back to Pleasant Ridge just a little bit, this one's for Kathy. Are you confident that Pleasant Ridge, especially with the county's involvement with that particular facility, that they are taking all the precautions they need to do to prevent more cases from happening?
Yes, I believe that Pleasant Ridge Manor all along has been trying to do everything they can to mitigate the spread. And unfortunately, as we've seen with nursing homes across the Commonwealth and across the nation, it's usually an asymptomatic employee, no fault of theirs. They bring the virus in, and unfortunately it can spread quickly and to the most vulnerable populations in our community, truthfully. And yes, but I do believe that they are working diligently every day to control the virus, to take care of the people that are in their care, as well as their employees.
Thank you.
Mm-hmm. Erie News Now, I think Paul, right?
Yes, Kathy. A lot of the high schools, most of them have gone to remote learning, but it's still at the discretion of the districts whether or not to play sports. Do you or Melissa Lyons are you giving any advice to these districts on the viability, whether they should be having sports in light of these the surge we're seeing?
Well, if you're okay with it, I'm going to have David answer this question because he works directly with the team that is out there supporting the schools. So, David, can you answer that?
Yes, thanks for the question. Many sporting events have begun to be canceled. We've been working closely with the Erie Sports Commission or postponed, and if they were to happen, to do them as safely as possible. Given that the state of affairs with even professional sports having issues with sporting events, they're having outbreaks. It's talked about all across the nation. It's difficult to maintain, to have sports during this pandemic. If there were, we highly recommend against it. And if those events are to take place with the new updates in the guidance, they should always wear masks, even during competition. The updated guidance said even cheerleaders should wear masks, not just when on the sidelines, but also in the field of play. So if those were to take place, masks should be worn at all times.
Thank you.
Thank you, and I just want to reiterate that because sometimes I have people tell me stuff, and I always do go back to the health department and ask them to check it out, but I hear about some clubs and different places like that where maybe not everyone's wearing a mask, but it is actually, the guidance now says everyone must wear a mask unless you have a physical reason why you cannot. And if you're doing pretty heavy-duty sports anyway, you probably don't have that physical condition. So it's the safest thing to do for everyone to wear a mask when you're out and about with other people that you don't live with. Talk Erie, Joel?
Yes, thank you, County Executive. Here's another question for David George. David, I'm wondering about this current surge, especially the last few days here. Could that be related to private parties over the Thanksgiving holiday because the governor had shut down the bars on that Wednesday night before Thanksgiving, didn't shut down the state stores? We had lines going down the block for the state stores. Could this, in hindsight, could this have been a better scenario for enforcement to have people in a secure place that were following the mitigation orders like the restaurants and the bars?
It's all speculation. The governor did shut down early on Thanksgiving Eve the sale of alcohol after 5 p.m. And given I also witnessed some of the stores, the fine wine and good spirits as I drove by, parking lots were full. They could have potentially had some parties. We did get a few complaints over the weekend about large gatherings on Wednesday night. but it's all speculation. Some of the numbers could have stemmed from that, but it's hard to tell. And then from an enforcement standpoint, it is hard to go onto someone's private property and see if they're having a huge gathering. But I'm not sure if opening the bars would have solved the problem either. So like I said, it's all kind of speculation if the rise did stem from the potential parties thrown on Thanksgiving Eve.
Just a quick follow-up, David. We're seeing reporting across the country where there are arrests happening now at private gatherings. You know, somebody had a basement party of 180 somewhere on the West Coast. Do you anticipate that's where the health department will be going if it's an egregious violation of the gathering order?
Yeah, if it's egregious, one of the hard things is it's hard to determine if these parties are going to take place. We find out about them after they've occurred. We're just asking the public to do the right thing, stay home if you can, to only stay with your close contacts, only go out for the essentials, and just to not throw these parties. But if the case were to come up where we know of a major event, we would talk to local law enforcement and try to stop the event before it even takes place.
Thanks so much.
Sure. Samir from Jet TV.
Yep. Hi. So this would either be for the county executive or Director Lyon. So as the COVID-19 vaccine is just on the horizon now, of course, going for approval today, I believe, would you like to see, I guess, employers, once available, to mandate that their employees get the vaccine?
I'm going to let Director Lyon take the vaccine question here.
Thanks, Samir. The question around having businesses or employers mandate that their employees become vaccinated is really the question of how the business ethically wants to approach their role in vaccine consumption in the community. And with that being said, I have to stick to a public health answer that the more people that are vaccinated, the quicker we are going to get out of this pandemic, and the faster we will get to a recovery stage from the pandemic. So it would behoove employers to support vaccine distribution, vaccine acceptance with their employees. But as far as mandating it, that becomes an issue that each employer has to address internally and with their lawyers and such. But I do ask that all employers take into consideration their very important role of increasing vaccine acceptance in the county of Erie so that we can get through this pandemic as fast as possible using the pharmaceutical interventions that we know will work. So thank you very much, Samir.
Thank you, Director Lyon. And then County Executive, just a really quick follow-up. So you mentioned one of the fears, I guess, with kind of new mitigation efforts would be, I guess, the house parties or parties under the radar. So I guess, is there a fear whenever college students come back to the area that this is also going to continue to soar?
Well, you know, I was that age once. And I think no matter whether you're in college or not, when you're in your early 20s, maybe even late 20s, you know, your friends are certainly extremely important in your life. And gathering with them is something that's very, very common and something that happens probably more often than maybe some people in the older generations. So it's always a concern. It's just, you know, something that we know can and does happen. And we know that the younger people, if they get COVID-19, tend to have more mild cases and sometimes don't have any symptoms at all, and then oftentimes become those spreaders that we've talked about. So it's always, always a concern. I would like to address your other question, though, if you're okay with that, Samir, about the vaccine. You know,
Definitely.
Good public health, a healthy populace, is absolutely imperative to a thriving economy. And Director Lyon has been on that drumbeat for years here in Erie County, often sometimes not being heard by those in economic development. Well, obviously since March, everyone understands that a healthy population, good public health, is absolutely essential to good economic development and to a thriving economy. So it would behoove business owners to truly encourage and to maybe even incentivize their employees to get the vaccine. And they could do that in a number of ways. You know, some of the vaccines have a cost to them, and maybe that's not covered under an employee's insurance if they even have insurance. You know, business could think about, do they want to cover the cost of that vaccine to try to encourage their employees to get it? So there's things that employers should be thinking about right now if they want to get themselves back to full capacity in terms of how their business runs. Thank you.
Thank you.
We'll go with the last question for everyone. David, last question, Erie Times News.
Yes, thanks, Kathy. It seems pretty clear who's going to get the first doses of vaccine, the healthcare workers and hopefully nursing home residents as well. It seems less clear who is going to get the next stage. I don't know if this is, I guess, more for Melissa. Do we have any kind of insight in the last day or two who will be the next groups of people to get the vaccine in Erie County after healthcare workers and nursing home residents?
Yeah, I'll ask Director Lyon to definitely take that question. Thank you.
Thanks, David. You are correct in your comments that the first phase seems fairly clearly designed. What we're referring to is phase 1B, which is the phase that you are indicating maybe not be as clear who the target population is for vaccine. I think we don't have a lot of clarity still on that. But I believe one of the pieces of information that's so important before they make that determination is how much vaccine will be available, how well, quickly, rapidly it can be dispensed or distributed throughout, let's say, the Commonwealth of Pennsylvania, and then what is the mechanism for delivering the vaccine to that target population. So as you can imagine, logistically, we still have to determine how this works best to be most effective. And honestly, I think those are some of the details that are being sorted out at the federal and state level. Each day that we get information, we hope that it tells us more clearly who that population would be or populations could be. Though I did ask back to the state level if locally we had some control on that decision making. Like, so for example, you know, this part of the state gets more snow than the eastern part of the state, and so we rely heavily on snow removal. And would a population of essential workers that fill those jobs be eligible for a vaccine? So there will be some local control on decision making if vaccine becomes adequate and quickly available. So I hope that answers your question, David.
Thank you, Melissa.
Thank you. Last question from Paul, Erie News Now.
Thank you, Kathy. Maybe for Melissa, this one. Contact tracing, obviously with 200 to 300 a day, your contact tracers can't even approach calling everyone. Do they have a priority, what they are trying to do right now with these numbers surging?
Yes, that is correct. There is a priority listing per se, or priority populations. So 65 and older that are not living in a congregate care setting are a priority. Those that we know are directly related to an outbreak, and outbreaks are related to facilities. And we want to get back to 18 and under, because we do know that they tend to be less symptomatic and have the potential to spread virus more quickly within family members and other settings. So right now it's been 65 and older, not related to congregate care settings, and then outbreaks.
Thank you.
Thank you. And Joel from Talk Erie, do you have a last question?
I do, and this one is for Director Lyon. Melissa, last week on Wednesday, you released your death demographics on the county website. Again, 76% of the deaths from long-term care facilities. You're releasing these monthly, but with the elevated rate of death, is there any possibility that the county health department could start releasing those on a weekly basis? And again, understanding that demographics are huge in trying to understand who's passing away from this virus.
Thank you for the request, Joel. I think that you put forward a reasonable request of being more frequent now that our numbers are seeming to have some significant increases. What I need to do is take it back to the team because these are generated on a routine, automatic reporting. We'd have to make some adjustments to that automatic reporting. So stay tuned would be my answer to you, but I appreciate the request and we'll try to accommodate. Thank you.
Thank you.
And lastly, Samir from Jet TV, do you have a final question?
Yep, this one is for, I guess, any of the speakers today. So taking a look at our numbers in the spread of COVID, of course, we had Halloween, so we had haunted attractions, trick-or-treating around, then we had Thanksgiving, and then just before Thanksgiving, the, increase of alcohol sales at the liquor stores. So is there any connection to any of those events, or do all three have connections to significant surges when it comes to COVID?
Well, I don't know that we have any specifics. As Director Lyons said, we've getting down to that level of detail has been difficult because of the sheer numbers that we are trying to deal with, and we haven't been able to contact the way we used to. So we used to have much better handle on some of this. But I would say yes, yes, and yes to all of that because it all brought people together. And I would throw the election in there too, because many people were gathered, whether it be in campaign headquarters for rallies or even at the polls. So there were many things prior to right around Halloween time, the elections, Thanksgiving, that could have led to these, and obviously I believe did leave, and I don't know that any of us have the data to say specifically, but you see this across the entire nation, and the entire nation shared in all those activities that you just mentioned. So I would say there is a correlation, most likely, but we here don't have the exact data to show that.
Thank you.
Sure. And I want to end today, of course, as we always do, to talk about our businesses because, again, in Erie County, I can't say enough about how almost all of our businesses are doing. So the Pittsburgh Inn, a landmark in our community on Westlake Road, has their dining at 25% capacity. They have closed and blocked off all bar seating, have separate entrances and exit doors to avoid congestion at the front door, and the tables are spaced at least 6 feet apart. And once the table has been thoroughly cleansed and sanitized, after a guest leaves, a sign is put on there that says that the table has been such. And so the next guests are notified that everything has been cleaned. The entire staff is wearing masks, and all guests are required to wear their masks when walking to and from their tables. Disposable paper menus to avoid commonly touched items, hand sanitizer stations, and again, doing a great job. Even if you don't feel comfortable there, you can do takeout and takeout cocktails even. An overwhelming majority of the businesses that the COVID response team has visited are doing truly an excellent job with their COVID-19 mitigation procedures. The environmental team at the health department really is pleased with the Erie County businesses, and that team has been doing a great job being their partners throughout this, again, educating them. So thank you to all of our businesses. Thank you for continuing to do everything you can do, and we're here to hopefully support you so that you are still viable when this pandemic is over. And finally, thanks to everyone who participated in our Masks of Erie contest. Winners were determined last night, and an official announcement of all the winners will go out very soon after all the winners have been notified. So as always, I ask you to please stay as close as home as you can. Always wear your mask when you're outside away from home with people that you do not live with. Please stay safe during this time, and as always, please try to stay calm. Thank you. And